Hi, welcome to another episode of RNR Talks. Today's episode talks about a very hot topic, that is diabetes reversal. So, India is the world's capital for diabetes. 17% of the maximum patients that come all over the world are in India. So, today I have somebody with me who spells magic, who believes in diabetes reversal for type 2 patients. uh, I have gone through a lot of testimonials about her, which talk about uh, her, what all magic she has created in 3 months, 6 months. And so I thought, let's bring out this story to people like you. I personally have a very deep journey with diabetes being in the family, and also facing it maybe because of my genetics during my child's birth. So, introducing to you Riya Dedhia, who is the magic person who can talk about diabetes reversal and who can tell us uh, more about it for people like probably families like us who don't believe in it. So, hi Riya, uh, if you can introduce yourself and tell us more about yourself.
So thank you, Ruchika, for having me on the show. It's my privilege to be here. For the audience who are here, my name is Riya Dedhia. I am a pediatric nutritionist and a clinical dietitian. I think the video is going to tell more about me than me talking in person, and you will know what work I am doing, how magic it I'm creating, in people's life, and it's just one line which I can say that which I truly believe is your body is the best doctor and it can heal itself. So we can start the show with that particular note.
So, I wanted to know, as just basics as a nutritionist, what are the basics of being a nutritionist? I mean, usually people like me get very scared when I'm talking to you. Like I spoke to you about lunch also today, and then I only told you, no, I don't know whether I will be able to, manage your level of diet. So, what does it mean by being a nutritionist?
So I just recollect a very one line that so eating junk food these days has become so common that if you're dieting, it means that you're doing something different. You're doing something which is uncommon, and that's considered to be a not normal. But let's create a world where dieting just means a routine. It's just a lifestyle change, and it's a choice which you make for yourself, for your genetics, for the futures to come, and leading a life free of medications and joy.
So, why did you choose nutrition as your career?
So giving a gist of my backstory, I had PCOS and I was pre-diabetic, back then in my college days. And I did have a great support of my family who was inclined towards health, and that's how I made a decision to enter into the career of nutrition and dietetics. For me, very important was to gain ample knowledge, because the way a doctor treats a client, or a doctor treats a patient, in the view that you need to holistically make that patient away from the disease, the same role is of a dietitian or a nutritionist, that you are just not treating a patient with food. You are allowing that patient to come out of their health challenges, to live a life of joy and well-being. And that's how that spark was there in me, and I chose the path of choosing into the field of nutrition and dietetics. And I took almost 5 years of education into it. Apart from this, I worked in various clinical hospitals, naming Tata Cancer Hospital or Fernandez Hospital, that's in Hyderabad. It's a maternity hospital, and many more. So once I've gained that abundance of knowledge, experience, I'm here on the field, helping how many ever lives I can and putting my contribution in the society. And that's how my journey started. And yeah, it's going to continue till eternity.
So, can you tell us more about disease reversal before we go on to the main
Hmm.
topic? What is disease reversal?
So, to audience, when we are addressing diabetes in this entire video, we are only addressing to type 2 diabetes and disease reversal of type 2 diabetes. So, disease reversal is actually, disease reversal actually means that you reach a stage where there is no insulin resistance and your blood glucose levels are normal without the need of medications, and you're sustaining on that particular path for years to come, and that's how you can term yourself as being a diabetic free or a disease reversed person.
So disease reversal also happens for some other diseases apart from diabetes?
Definitely. So all the lifestyle related disorders can be reversed. Like personally, I have reversed my PCOS completely. Then there are other lifestyle disorders like cholesterol, liver disease, when you are into fatty liver grade 1 and not the severe ones. There are arthritis. Then you have any other, joint related disorders. Apart from it, weight loss is something which comes with abundance of diseases together. So definitely all the diseases which come via your lifestyle changes, you can definitely reverse because they are controllable factors. So once you remove those controllable factors, you are free from any kind of diseases and there's no need of any medications to treat yourself.
So, can you just tell what is the basic difference between type 2 and type 1 diabetes?
So type 1 diabetes is an autoimmune disease where the body's insulin producing cells are not able to produce insulin. So their body doesn't have insulin at all. Whereas type 2 diabetes is actually a lifestyle disorder, mainly due to insulin resistance, where the body cells are not able to respond to insulin. So
Okay.
that's the major difference between type 1 and type 2 diabetes.
So type 2 is more lifestyle oriented
Correct.
and type 1 is genetic.
Correct.
But still, why is India the diabetic capital of the world?
So first reason is that we are Asians and we have a pot belly, we have a pear shaped body. So, a genetic itself poses us as a greater risk at being, at acquiring any kind of a lifestyle disorder. But let me put this forth that genetic is not the primary cause. We cannot blame that मेरे genes ऐसे इसके लिए मुझे diabetes हुआ, मेरे genes ऐसे इसलिए मुझे cholesterol हुआ. Definitely it plays a role, but it's not the causative factor. The Western culture or the civilization which has take place, and we have gone far away from our roots, is one of the cause that we are acquiring any kind of lifestyle disorders, and it's purely to do with the lifestyle. And there are four pillars which I always discuss in my videos or anywhere. First is diet, second is your exercise, third is sleep, and fourth is stress. So if all these four pillars are in line, your tabletop will always be stable. But if any of the pillars, is imbalanced, the table is not able to stay still, and that's the reason you have imbalance in your life, and any kind of a disorder is something you are going to acquire.
So, I have one question here is that, see in the West, especially in New York or in USA, their kind of food is more bread based.
Correct.
Say maida based. So, but comparatively, if you see in our kind of food, we have a balance of roti, rice, majority of houses. Then we have so many masalas which they don't eat, which are self anti-inflammatory like
Correct.
haldi and other things also. However, I do understand that probably our consumption of oil and ghee must be comparatively more. But we do know that the West has a lot of kind of their diet is still what I would say more sedentary kind of diet rather than ours. I mean, India has a culture where 2 time खाना बनता है, चूल्हा दिन में 2 बार बनता है, which is traditional. I mean, in USA or probably in UK and all, in Canada and all, they don't have that kind of a system.
Correct.
So, still, why are we okay? I do understand genetics is one factor, but then if it is related to food, why are we still, since we have so much of fresh food, fresh vegetables, all those kinds, still why are we still prone to? Is it because of the sweets or is it because of is it because we are not the happiness capital of the world? So what can be the reason for that?
So that's a really good question because it's there in everybody's mind. So let me tell you, though in India we have variety of dishes, we make fresh food, but if you name common dishes from breakfast, it starts with poha, upma, paratha, thepla, or if you go to lunch, it is either roti, bhakri, rice, or any of those preparations. So even if we are not eating bread so much, but we are surrounded by carbs, which is carbohydrates. So, variety, but the source or the macronutrient which you get from those particular dishes is carbohydrates. Even if a sweet consumption may not be very high, but your carb consumption is high, and anything you eat, especially carbs, it's going to get converted into glucose, and that glucose is going to spike your sugar levels at some or the other point, right? So that's one thing. Second thing is, पहले क्यों नहीं होता था, अभी क्यों हो रहा है? पहले भी लोग यही खाते थे, अभी नहीं खा रहे हैं. So if you are comparing the eating habits, we should make sure that we are even comparing the lifestyle. So earlier, when people used to eat the same food, they used to work in farms, they used to work under the sun, where they used to get vitamin D. Physical activity used to be very high. They were using their legs to walk short distances than we taking a cab or a rickshaw to go for short distances. So whatever they were eating was getting metabolized, and that energy was getting consumed, and that's the reason they never had that pot belly. But right now we have been like a couch potato. हम खा रहे और बैठ रहे हैं. So that change of drift is something we need to note. And if in this particular era, our lives are very busy, we do not have time to exercise, or we do not have time to go for a walk, that simply we need to understand what is the balance of calorie intake and the calorie expenditure. If you understand this balance, I think the table is always going to be in a good balanced state of well-being.
So let's start with the diabetes reversal topic. So I wanted to know, what's the basic of diabetes reversal? How does it work? Like, we were just having a conversation. A lot of people don't really believe in it, or don't want to take the risk with their lives. So is there any research which proves that diabetes reversal is possible?
So definitely these days there have been researches, you find it online, that diabetes reversal, where type 2 diabetes is concerned, is definitely possible. Simple hai ki you have, I'll just give you an example, that what happens in the body is, these are your cells, your pancreatic cells, and these are your normal cells which need sugar to work. Now in diabetics, what happens is, there is a wall which is created here, and that wall is of mainly fat, and that creates insulin resistance. So the insulin which is produced is not able to go till the cells, and that's the reason the insulin is resistant to go towards the cell. अभी सेल का अलग स्टोरी है. सेल पे जब भी इंसुलिन आएगा तभी वो ग्लूकोज अंदर ले सकता है. ग्लूकोज कांट गो अलोन इनसाइड द सेल. So because the insulin is not able to come till this particular level, the sugar or the glucose remains in your bloodstream, and that's how you increase your blood sugar levels. Here you have noted that the insulin producing cells are doing all well, your normal cells are doing all well. What is the problem? The wall. And who has created that wall? Us. So if you break the wall, you reverse your diabetes. It's that simple a concept to be explained to anybody who has type 2 diabetes. Now, there are also a lot of people these days I come across who have lean diabetes, where they do not have extra fat in their body, but they still have diabetes. So in that particular, in those particular segment of people, very important to understand is the sensitivity of insulin might have gone down. There, I'm not saying that everybody would be able to reverse diabetes. You definitely need to do the blood check, that if your insulin producing cells, are they producing enough insulin? If yes, then the factors can be controlled. If the cells itself are damaged, then nothing can be done. Now, in those who are lean and have diabetes, mainly the insulin sensitivity is a problem, where there is no wall, but the cells are not potent enough to take that insulin and the glucose inside, where you have lot of factors where you can take into consideration to sensitize those cells to take that insulin with the glucose. And of course, there are a lot of herbs also that do help into it. And major factor I've seen in those people is stress. So जब भी खाना नहीं होता है तभी दूसरा फैक्टर मोस्टली स्ट्रेस ही होता है. तो समझना जरूरी है कि कॉज क्या है, एंड उसके हिसाब से ट्रीटमेंट होता है. इट्स नॉट वन शू फिट्स ऑल. It's the cause to the treatment, and that's how you're free from diabetes.
So I just want to know the ratio. How many diabetes free reversals have you possibly been able to do?
So usually I don't keep a count.
But on an average.
Yeah, so you can say maybe more than hundreds when I mean type 2 diabetes. So definitely more than hundreds. And these days, it's really shocking. But I get teens walking in my clinic with insulin resistance. Though their blood reports might not show a high levels of sugar, but there's something which is called as insulin resistance, which can be noticed with symptoms in your body. And the basic symptom is acanthosis nigricans. So that's a symptom where you have darkish black coloration behind your neck, under your arms and inner thigh. तो ये आजकल मतलब ट्रेन में भी जाओगे ना, आप किसी का नेक देखोगे ना तो आपको समझ में आ जाएगा कि वो डार्किश डिस्कलरेशन एबनॉर्मल है. That's a sign of insulin resistance, a mere sign which gives you an indication that you need to get yourself checked.
So is insulin resistance a sign of pre-diabetes or diabetes?
Both. Definitely it starts with pre-diabetes, but definitely you see insulin resistance in pre-diabetes as well.
So if insulin resistance comes into catch, is it easier to treat diabetes or easier for diabetic reversal, or is it like considered, can it be considered as a first stage?
I'll tell you one thing. हमारी बॉडी है ना, कुछ एक चीज पे वर्क नहीं करती है. Everything works together. For example, if I ask today, that my kidney should work, and let me give my heart a rest and let my heart work tomorrow. It doesn't happen that way. Everything works in coagulation and everything works in amalgamation with each other. So again, with respect to diabetes, though we spoke about insulin resistance a lot, it's one of the reasons why you're getting why you can acquire diabetes. But there are multiple other reasons. For example, one of the second reason which I can share is inflammation. That's also one of the cause of diabetes. Third is your gut health. तो ये एक चीज बहुत बोली जाती है हमारे इंडियन सिनेरियो में, एंड हमारे एंसेस्टर्स या हमारे ग्रैंड पेरेंट्स बोलते थे कि अगर पेट साफ नहीं है ना तो कोई ना कोई बीमारी होने ही वाली है.
Right.
So where they mean पेट साफ नहीं है, they mean gut. And to the audience, I want to say that gut means intestine and not your stomach. Okay. So when you say you have a gut feeling, it means you have intestinal feeling. So jokes apart. So now when I was talking about gut health, that's also one of the factors. So if your gut microbiome ratio is not balanced, again, you need to get that into check because it's responsible for insulin sensitivity.
So on that, I just have got one question. Probiotics are very much popular nowadays, but this is my personal thing which I have found out after I saw the ingredients on the probiotic of the most profound company that is selling probiotic drinks. It has sugar, then it has a product which says less sugar, but then there is no probiotic which is the product which itself sells itself as a probiotic. So एक तो वो हो गया कि why are they selling a product with sugar and then without sugar maybe I don't know 25% sugar के साथ में. Secondly, natural elements क्या होते हैं probiotics के, if you are talking about gut health? I just thought I should push this question since we are talking about sugar and diabetics as a whole.
So probiotic का meaning समझते हैं. So probiotic means live bacteria. So you're giving live bacteria to your gut, and it's a very interesting message or an interesting information that we are 90% made up of bacteria. हम सिर्फ 10% ही है. 90% what we are actually bacteria. And talking about probiotic, it's very important to understand that there's a ratio which our gut maintains. आजकल क्या हो रहा है कि you are having probiotic, but the ratio of good bacteria is much higher than the ratio of bad bacteria. So this ratio is again imbalanced. You need a balance of ratio. You cannot be having very high good bacteria and very low bad bacteria. It has to be always in constant balance. That's one thing. Second thing, definitely you mentioned about the product. So, the very basic irony is sugar kills a good bacteria and the product has good bacteria. So I don't know what the product is doing in your body because sugar is going to kill the bacteria. And again, you're putting the bacteria. So you can think what's happening. Basically, next thing is, rather than focusing so much on probiotic, these days the studies say that focus on prebiotic.
Okay.
Which means food for probiotic.
Okay.
So our gut has the capacity to make bacteria, then let the gut do its role. सब कुछ ready-made क्यों देना है हमको?
Right.
Let's give prebiotic to your gut so that it can produce bacteria, and your gut has always had the best ratio of your good and bad bacteria.
So, coming back to diabetes reversal, let's talk about the procedure. I mean, starting from, a patient with H1ABC, say 9 or 10 or say 12 itself enters your clinic. What happens next?
First thing is कि whoever's got the HbA1c higher, they are never going to come directly running to a dietitian or a nutritionist, which should be the case, but वो नहीं होता है. They're always going to
Because
run.
there is always a scare. Because आपको
Scare नहीं है.
nutritionist, I know because I have gone through this when I was gestational diabetes, and because I already knew that my parents have it genetically, I got tested in the first 3 weeks only. The moment I think I got my pregnancy test confirmed, and within 2 weeks or the next week itself I got myself home tested, and my sugars were pretty high. Like they had crossed like 250, 300, even though I was on this thing, what do you call, metamorphin. It was not probably working for me. I went to a diabetologist. They told me insulin. The nurse in fact told us that अच्छा हो गया आप आ गए, वेरी गुड, बिकॉज इधर तो 7 महीने में और 8 महीने में 300-400 शुगर लेके लोग आते हैं, एंड ना हम वो लेडी का डाइट कंट्रोल कर सकते हैं, ना उसको हम इंसुलिन दे सकते हैं. सो द nurse was pretty happy with me, who taught me how to take the insulin part. However, what I'm trying to say is every dietitian that I went, mostly in my journey of my pregnancy, my insulins were pretty much like levels were pretty much good, like in the sense maybe for you not good, but at least they were around 7.5, or that range where I was trying to eat whatever I was able to, to keep my cravings, plus for nutrition sake. But still, all new dietitians used to blast, they used to tell me, अरे ये क्या है ऐसा, how is it possible, बंद कर दो, ये भी बंद कर दो, ये भी बंद कर दो, प्रोटीन शेक पियो खाली सुबह में दोपहर में. So I used to get very intimidated by the dietitians, and then obviously I wouldn't go to them the second time, right? Because if you batter me and tell me
Correct.
कि तुम ये भी मत खाओ, वो भी मत खाओ, वो भी मत खाओ, भूखा रहो, खाली दिन में ड्राई फ्रूट्स खा के जियो, and then later on my pediatrician tells me when I am in 7.5 months that you're, of course I know, because I have a very deep discussions in my house. I have a lot of people who deal with the same thing, who are doctors as well. I know I don't want a baby who is having the diabetic weight or whatever, but my pediatrician tells me आप बराबर खाना नहीं खाए इसलिए बच्चे का weight नहीं बढ़ रहा है. So it's very complicated. What I'm trying to say is, maybe for somebody who has the knowledge, it's okay, like we come home, we get angry, then we balance ourselves. But probably I wouldn't walk into your clinic if you first time only batter me and tell me, अरे इतना H1 ABC 12 है, तुम तो जाने वाले 2 साल में ऊपर. So I just want to understand from you, how does it work when somebody comes to you?
Okay. So let's take a scenario where somebody is enlightened to come to a dietitian. Okay, because that's going to answer the question much better. So very important to understand as a therapist is empathizing. You keep yourself in the other person's shoe. Is that time you understand what the person is going through, not just physically, mentally, emotionally, family pressure, social pressure, and whatnot. So it's very important as a therapist to empathize with the patient or with whoever's walking down the clinic. That's first thing. Second thing is, it's very important to accept whatever has happened. Definitely you need to realize what are the factors that brought you here, but today you are standing in this position, and if you are willing to come out, acceptance is very important, and trusting the therapist is very important. That's the another part of the story. Next thing is, on day 1 you don't start to tell them ये करना चाहिए वो करना चाहिए. Day 1 पे डायबिटीज रिवर्सल पे नहीं जाते हैं.
Okay.
Okay, it's always starts with A, B, C, D. आप पहले first standard जाते हो, second standard, and then you go to the 10th standard, right?
Right.
So somebody who's walking down in the clinic with me, I know that already that person is malnourished with nutrients. I cannot be giving them great functional foods or a good low glycemic index diet to get their sugar levels down in the first week. I first need to give them the right nutrients, the right nourishment for their day-to-day activities.
Right.
That's the base. That's the first step. Once the body has the right nourishment, and the second step comes is um, filling the nutrient stores. So, because you have been deficient with a lot of nutrients, the body has already replenished all the stores in your body, like iron, calcium, protein. You do not have the stores. After you are nourished, you need to replenish those stores so that the body knows that, yeah, now I'm comfortable and I'm not in an alarm state. I'm not in a flight or fight state where I need to keep fighting with something. I have my stores ready with me. That's the approach to start with. Once the person is comfortable in this aspect, following a balanced diet, following what the body needs, and here I'm not just indicating diet, I'm indicating your diet, I'm indicating your water intake, indicating your stress levels, indicating your good quality sleep for better healing and relaxation, as well as activity. Once you're comfortable with this, you know you can sustain on this particular lifestyle for years to come, is the time you intervene for a diabetes reversal journey. And usually this time frame is what I've seen not doesn't take place more than 7 to 10 days, because what I believe is, if you
7 to 10 days.
correct, to get,
I thought months.
no, for not for the reversal, 7 to 10 days to get into a balanced state of well-being, and then you start the reversal after 7th or 10th day, is what I'm trying to tell you. In that particular duration, trust me, maybe just 1 out of 10 might not have continued, or might have felt I would not want to continue, but 9 out of 10 of whom I come across, or who have worked with me for 7 to 10 days, they are absolutely motivated to continue this lifestyle because they are enjoying it. They are able to see better productivity at their work. They are able to do their normal day-to-day activities with a high energy levels in the evening as well as they were had in the morning.
Okay.
So in this entire story, what I wanted to pinpoint was a sustainable lifestyle change.
Okay. So what do you mean by sustainable lifestyle change?
So sustainability simply means doing something on day one. You know you can do it for the next 20 or 30 years of your life without feeling missed out on something, with joy, with happiness, with a sense of true health, well-being, and for a fitter tomorrow. That's what is called sustainability.
So let's start up and debunk some myths about what are commonly heard. So is jaggery a substitute for sugar?
So let's talk basics. Where does jaggery come from? Sugarcane. And where does sugar come from? The same mother. So the mother of jaggery and sugar is sugarcane. So all the products are going to have the same properties as that of the sugarcane. Now, why jaggery is considered a better substitute of sugar is because process of making jaggery, gets more minerals in the jaggery, and so it's considered better than sugar. But let me tell you, the sugar spike, what sugar is going to do, jaggery is going to do the same thing, because the carb content is same in both of them. It's just the difference of minerals present in the product.
So, but still, like it's been so much popularized, especially after YouTube ki jaggery healthy substitute hai, use kar lo. ये if you can debunk this and tell us कि क्यों आया है, I mean why has this been such a big root?
So मैं ना हमेशा रूट्स पे जाना प्रेफर करती हूँ. तो पहले जैगरी कैसे बनता था? You used to make jaggery in iron vessels. आयरन के यूटेंसिल्स वेसल्स जब मशीन्स में बनते थे, इसके लिए वो प्रोसेस में जैगरी में आयरन आता था, एंड इसके लिए जैगरी वाज कंसिडर्ड एज अ सोर्स ऑफ गिविंग यू आयरन एज वेल. But today it's made under machines which are maybe metal machines, where you do not get those nutrients in the jaggery, And are you so sure that the jaggery you're having is actually jaggery? It has so many added things into it to make it that consistency, and to make it that shape. So definitely it's going to do the same thing as sugar. Why is it there so much in the market is कि हमारा माइंड को हमने जो मतलब जो दिखता है ना वो बिकता है. तो किसी ने बोल दिया जैगरी इज अ बेटर सब्स्टिट्यूट एंड वी बीन हियरिंग इट सिंस इयर्स दैट गुड़ खाना चाहिए, सो वी हैव रिलेटेड बोथ ऑफ देम एंड वी आर डूइंग व्हाट वी आर डूइंग टुडे. But it's important to rationally think certain things, that the mother is same, so the product is also going to be the same thing.
Right. And the second myth that we have is diabetes is genetic, comes through genetics, and it's hereditary, it's passed on. So how far is this true, or how far is it not true?
So if you Google out, one of the factors you will find of acquiring diabetes is definitely genetic. But let me tell you, if you are a diabetic, you cannot blame on your genes. You cannot blame on your ancestors and parents for the things which you have done it. Definitely genetic plays a role, but not more than 20%, and this number is very relative. But majority portion is in your hand. The controllables is in your hand. You sleep in time, you move your body, you eat right, you nourish your body. That's all in your hand. If you're doing all of these things right, you are definitely not going to enter diabetics, even if your genetics are so strong.
Wheat, rice, yeah, I mean nowadays considered as there's multigrain atta, then there's diabetic atta, then there's diabetic oil, then there's brown rice which is popular. What is the reality? I mean, is it true that consumption of all of this considerably increases uh, your road towards diabetes, or it makes it life more difficult for diabetics as such, or is there is there something else hidden behind it?
So majority of the time somebody getting diabetes, उनके mind में आता है कि rice नहीं खाना चाहिए, potato नहीं खाना चाहिए. You stop having, what other thing you told me?
Rice हो गया,
Potato
potato
होता.
now there is wheat, I mean
So basically जो भी diabetic होता है उनके mind में पहली चीज आती है कि rice नहीं खाना चाहिए और potato नहीं खाना चाहिए. अभी let me tell you one thing, हम कभी भी कोई meal खाते हैं, especially in an Indian scenario, we do not have just rice, we do not have a plain potato, we always have a complementary dish with it. So when you have a bowl of rice, you are having a bowl of dal with it, or you are having a vegetable with it. So what happens is the glycemic index of rice. Glycemic index is the amount of carbs that increases your blood sugar level, is called glycemic index. So the glycemic index of rice is reduced when you put dal to it, when you put some ghee on it. So वो reduce हो जाता है. So it's not going to raise your sugar levels that much. And same is the case with potato or any other high carb ingredient. Next, when you say that there are a lot of products in the market that are marketed that they are diabetic friendly, they are good to reduce your blood sugar levels, it's just that they've understood what you need and they've understood the problem. The market has understood the problem and they are just doing their business out of it. Even if you eat your ghar ka bana hua roti, if you eat your millets simply as jawar bajra, which we make it at home, your normal white rice, it's going to do no bad to your body. And let me tell you, all my patients are eating only their home cooked foods which they have been eating since years. I don't ask them to include millets like quinoa or foxtail millet or some other millets, because that's something which is not sustainable. In the end, the answer lies is whatever you are doing, is it sustainable? If it's yes, it's a tick mark. If it's no, that's something which you will never be able to continue. And what you do for short term is never going to give you result in long run. And we are going away from what is diabetes reversal. That doesn't come under diabetes reversal then.
What is the myth around seasonal fruits? I mean, there's a very popular dietitian who talks about she even talks about eating mango for diabetics also. She says कि seasonal fruits खाने चाहिए चाहे जो भी हो. If you are staying in India or you are staying in Maharashtra and whatever region you are, region specific. So what is your ideology, or what do you think? Is it a myth? Because people run away from mangoes when they have sugars. People run away from chiku. People run away from, well, I think majority fruits. So fruits तो फिर आप खा ही नहीं सकते. So what do you think about it?
So while you were asking this, I just recollect one of my clients' story. So he was diabetic since almost past 15-20 years, and when he started with me, I think it was maybe in the month of April, and May is the time when you get good mangoes. So I told him that now it's mango season and you may eat mangoes. He was shocked. He said, I have not touched mango in the last couple of decades because I knew it, it's going to raise my sugar level. So I have not touched it despite being my favorite fruit. I told him that you have to trust me. You have to eat mango the way, I am guiding you, and it's not going to raise your sugar levels. And trust me, the entire month of May, for 30 days, he's had mango. And he's reversed his HbA1c in 3 months from somewhere about 9.7 to 7.2 with having all kinds of fruits. So definitely it's not about avoiding any fruit, but it's how we eat. So it's a very usual, scenario in our house of eating mango, majorly in Gujarati families, because I come from a Gujarati family, that eating roti with mango is like a best combination. Ras puri hai, roti with mango, वो मतलब best combination है. People are going to wait for that.
And you can't live, the month can't pass by.
Correct. So if you see this combination, mango has carbs, but it has fructose as carbs. Roti, it also has carbs, maybe some other kind. So when you have a carb overload in the same meal, it elevates your sugar level.
So there must be some portion control also, right? For the kind of fruits that we are talking about.
Correct. So first thing is understanding the combination. So you are not supposed to combine fruits with any other main course in your day. That's the first rule. The second rule is when you're having fruit, especially sweet fruits, you always combine it with either nuts or groundnuts or coconut because they have good quality fat and that reduces the glycemic index of the fruit. मतलब वो जो मैंगो आपका शुगर लेवल बढ़ाने वाला होता है तो आपने नट्स डाल दिया तो वो शुगर लेवल नहीं बढ़ाता है, वो नॉर्मल जो बढ़ाना चाहिए उतना ही बढ़ाता है. So that's the second thing. Definitely portion size is something to be taken into consideration, but let me tell you, when you are having nuts with fruit, आपको इतनी भूख नहीं लगेगी कि आप 2 मैंगो खाओ, because nuts are going to be so filling, they have fats in them.
Right.
तो आप एक मैंगो खाओ और आप nuts खाओ, वो इतना filling होने वाला है that and you are even satisfied. So this is the rule for all the fruits you are eating. Next thing is, अभी पूरे महीने में एक बार रस रोटी खाए तो कोई प्रॉब्लम नहीं है, right. वो आप एंजॉय कर सकते हो, but this is something we are talking about a overall duration of the time, like not daily. एक बार खाया उसमें प्रॉब्लम नहीं है.
So what are the kind of myths that you come across? So which are probably funny, or maybe you feel that ये क्या लेके आ जाते हैं मेरे पास?
Of course I accept all the myth coming to me. I've surpassed that line of thought of judging the other person, definitely, because there is something which they are carrying with me. One thing what is very common in everything is restrictive eating. And it is so much talked about that I have to restrict my sugar intake, oil कम करना है, मुझे carbs कम खाना है, मुझे ये नहीं खाना है, वो नहीं. So basically no's, there are so many no's when you put yourself into a diabetic shoe. That's a myth also, or maybe that could be a reality also on the social media where you say. Now addressing to this particular topic, let me tell you that this is my ideology. So restriction is ideally not required. Very important to understand is moderation is the key. If you want to sustain on anything, if you moderate everything, it's always going to be the place where you're going to reach the level of well-being. अभी एक story बताती हूँ इस पे कि when you're restricting on anything, what does your mind do? For example, if you ask your child ये मत करना, वो करने ही वाला है वो चीज.
Right.
मतलब ये हमारे लिए, हमको अगर कोई बोलेगा dare you do this, you're not supposed to do it, you are going to do that the first thing in the morning, right? Which means our brain, catches all these negative emotions or these negative words so profoundly that it pulls you to do that.
Right.
Rather, if you transfer your focus to what you should be doing, ये सब चीजें हट जाती है.
Right.
मैं कभी भी बात ही नहीं करती हूँ क्या नहीं करना चाहिए, क्या नहीं खाना चाहिए, क्या नहीं करना चाहिए, इस पे बात ही नहीं करती हूँ, because it is waste of time. You are not going to reach anywhere by not doing anything.
Right.
But if you talk about what to do, you are always going to reach to where you want to be. And जब भी आपका focus ये side पे है, ये पूरा dark area है, आपको दिखेगा ही नहीं, आप इतने busy हो जाओगे ये सब करने में कि आपको टाइम ही नहीं मिलेगा. अरे मुझे ये तो
something rather than restricting yourself for something.
So this is something where you work on your psychology as well. So definitely I explained it with an interesting example, but this has a scientific reason behind it, because 80% of the disease reversal part यहाँ से होता है.
So do you think diabetic patients, especially in the newer generation that you see, they go through a lot of depression because of like you mentioned, most of them come to you with restrictive life, or is thinking like up to see most of I've also heard this from most of people when you say that, oh, I have gestational diabetes, oh, I still have diabetes, I'm on insulin, or I'm on whatever. They'll look at you with such big eyes, and then they'll tell you, अब जिंदगी खत्म, अब तो तुम तो ये नहीं खा सकते, वो नहीं खा सकते, ये नहीं खा सकते. So what I want to ask you is that, do you consider, do you see patients showing symptoms of depression?
I would not put it into depression, because it is a clinical symptom which only a psychiatrist or a psychologist can diagnose. Definitely, I can say that they do come with a mental trauma. Majority of them, they do come because first thing, acceptance. नहीं होता है acceptance. Second thing is peer pressure. Now, when we're talking about the young adults, they are with their colleagues. So it's very awkward for them to tell anybody, "अरे मुझे diabetes है." It's something you can't converse with anybody. Next thing is, majority of these younger adults come to us with a very high HbA1c levels or sugar levels. तो पहले जब भी वो डॉक्टर के पास आते हैं तो डॉक्टर उनको बोल देते हैं, अरे इंसुलिन चालू करना पड़ेगा अगर आपने कुछ नहीं किया तो. So even if they're not starting, but mentally वो प्रोग्रामिंग चालू हो गया कि now I might have to do this. And first thought being a diabetic is I cannot enjoy my life. मतलब वही चीज आता है कि I can't do this, that, and can't enjoy my life. So definitely mental trauma is something which is seen in younger adults and those who are newly diagnosed diabetic. Now, what's the solution? It's simply a therapist's responsibility to empathize, a therapist's responsibility to tell them it's fine, you can come out of it. It's just a challenge in the life has thrown on you. You can definitely have solutions to come out of it. That's next thing. And the very most important thing is counseling. So I'll tell you one thing, you will get n number of diets on Google and people are following it. But still, why do you go to a dietitian or why do you go to a nutritionist? The reason is the approach of doing the same thing what is written on the paper, the counseling, the mental support, and then accountability. हमको सुबह जिम जाना है बट कोई साथ में होगा तो जाएंगे. Accountability is so important in life that pushes us to reach our goal that way. So that's the way to treat diabetics who are going through some or the other kind of mental disturbance or stress and help them come out.
So is diabetes, or do you term it as a disease, in crude language, ये तो बीमार है, or do you consider it as a condition or a challenge?
Ideally, if you say scientifically, it's a disease, but it comes with whole lot of disorder. What do you mean by disorder? कि एक चीज से बहुत सारी multiple चीज link होती है, उसको disorder बोलते हैं. Now, understanding that our organs are interlinked with each other. If your pancreas, which is responsible for diabetes because of the diabetes producing cells, अगर उसमें कुछ प्रॉब्लम हो रहा है तो डेफिनेटली उसके आजू बाजू ऑर्गन से भी प्रॉब्लम्स होंगे. So very first thing which is linked with diabetes is high cholesterol level or high triglycerides level. तो वो एक linking factor हो जाता है. Second thing is any kind of a liver disease. I think so many people coming down to me with diabetics and fatty liver grade 1. So they are linked with each other. Now understanding that diabetes is a hormonal related disorder. So your other hormones in the body are also going to be in a havoc state if your insulin is not working properly. In females, you see PCOS related to diabetes, you see hormonal imbalance related to diabetes, and definitely in males also it's seen that thyroid hormone is also linked with your diabetes. So one thing can lead to many. Unless you take action at the right time, you can save yourselves and your organs and live a life of, maybe longevity and
a normal life.
Yeah.
Basically. So going to our next question, I wanted to ask you something which in our mind, that is pills versus insulin. Actually not pills versus insulin, but I want to understand the difference between the dependability on these medicines that we have. Are pills more effective? Do they have more side effects? Or is insulin like a kind of a substitute product for something that is being produced already by the body, and then insulin just replenishes it and it has lesser side effects? And can somebody be insulin free, or somebody who's type 2 diabetes also maybe taking insulin during gestational diabetes be insulin free? Is it possible to be even pill free?
So it's a very interesting question. I think every diabetic has that in their mind. First thing to understand is what is happening in your body. Which stage of diabetes are you in? In the early stage, uncontrolled stage, or in the complication stage? So it's very important to understand the stage. And definitely this decision is taken by a diabetologist or an endocrinologist. But giving you an overview is definitely somebody who is a type 1 diabetes has to be on insulin throughout his life, because the cells producing insulins are not available. So we keeping that segment of population aside, we are talking about type 2 diabetics. Now there are certain scenarios, or there are certain cases, or there are certain scenarios where insulin is the only way to treat diabetes. Like definitely you told me during pregnancy. So because any medicine you eat, may it be a paracetamol, it is going to have some or the other kind of a side effect. But insulin doesn't have any side effect because your body is also naturally producing insulin, and that's what you're giving. So that's the reason pregnancy is a stage where you do not want to put any complications to your fetus or your growing child. And that's the reason insulin is the only solution during that time. Second is, if the HbA1c levels are about 10, then the treating doctor is always going to prescribe you insulin over medicines, because medicine is going to work a little slower than insulin, and you need to get down your sugar levels at a faster rate, because if they're going to be high for a long period of time, it's going to settle at 3 paces. The sugar का favorite है 3 चीजें. एक तो retina, your eyes. Second is your kidneys, and third is your nerves. So they're going to go and settle there, create home, and damage the blood vessels and the functioning of that particular organ. So that's the reason the doctor is going to put you on insulin if your HbA1c is above 10. Now, sorry to interrupt you here. So let me share one more insight over here, that even if we talk about insulin or we talk about the medicines, they are not cure. They help you to manage your diabetes. The cure only lies in lifestyle changes. So you are put on all these things so that on a temporary basis, at least the external pill or the insulin is going to reduce your sugar level until you adopt a lifestyle where your body can naturally do it. Now, even if I told you that insulin has no side effect, you might have it in your mind, अरे अच्छा है ना, एक इंजेक्शन ले लिया, सब कुछ खा लिया. वो चीज नहीं होता है. First thing is, you cannot be injecting yourself with insulin 3 to 4 times a day. That's first thing. Second thing, it's costly. It's not a cup of tea to buy insulin, to store insulin, to do it. And third thing, if you give something very easy to the body, even if the body has the capacity to make insulin, the body is then going to stop making insulin because it knows I'm going to get it from outside. तो मैं क्यों मेहनत करूँ?
Right.
तो अगर आप ये सोचोगे ना इंसुलिन लेके इजी है, तो ओवर पीरियड ऑफ टाइम जब आपको बंद करना होगा, आप कभी ट्रैवल कर रहे हो तो आपकी बॉडी बनाएगी ही नहीं इंसुलिन, क्योंकि उसको इजी मिल रहा है बाहर से कुछ तो.
So is it possible to go insulin free also after a certain point of time?
It's possible, but it is very case specific. It can't be generalized that anybody who is on insulin can go free. Very important to understand that if you're diabetic for a long period of time, which is called long standing diabetics, your cells, the beta cells of the pancreas, they might be affected. And if there are changes which have already taken place at cellular level, तो वो complete reversal possible नहीं है, because वो देर कर दिया आपने. उसके पहले के स्टेज पे आ जाते हैं जब भी सेल्स में खराबी नहीं हुआ, then it is possible.
So कैसे पता चलता है बीटा से? Is there like we as layman people know that diabetes check करने के लिए, I've had this discussion with another doctor also. We know that H1ABC test हो जाता है, sugar सुबह postpartum and morning sugars, breakfast sugars check होते हैं. तो इसके अलावा how do you know that how much damage is being done to the beta cells?
दो बहुत इंपॉर्टेंट टेस्ट होते हैं जो हर डायबिटिक हो या कोई नॉर्मल पर्सन भी एक रूटीन ब्लड चेक के लिए जाता है तो करना चाहिए. इज योर फास्टिंग इंसुलिन and postprandial insulin. The way you do your fasting sugar and your postprandial sugar levels, you even need to check your insulin levels. कि आपका fasting insulin कितना हो रहा है, वो range में है या नहीं, and आपका postprandial insulin कितना है. अगर आपको पता चल गया है that your insulin are in range, which means maybe the cells are working. Okay. Even if 80% work कर रहा है, 100% कर रहा है, उतना डिटेल में जाने की जरूरत नहीं है हमको. Even if you get to know what are you going to do with that information.
What is the range that you think is is as per your knowledge? Because there's a lot of debate over this that happens. 200 sugar में भी लोगों के operations होते हैं, 200 sugar में भी C-sections होते हैं. So in my opinion, with my senior citizen parents and my C-section delivery and everything that I've seen here, is what happens is जब इमरजेंसी सिचुएशन आता है तो डॉक्टर्स बोलते हैं 200 शुगर है, कोई बात नहीं, लेट जाओ, हो जाएगा. चाहे वो आपका आइस का ऑपरेशन हो, कैटरैक्ट का ऑपरेशन हो, चाहे आपका सी सेक्शन हो, चाहे वो कोई और भी चीज हो. सो as per your understanding, what is the definitive range where the alarm starts and you should be like, oh God, I am now, this is like I can't do now, कुछ तो करना पड़ेगा वाला.
Right.
Not that I'm saying कि आप normal age के beyond ही work करो, but I'm just trying to ask you.
So very important to understand that what ranges we are getting are guidelines. There's a difference between something that's guiding you and something what's happening in your body. That's the first thing to understand. Second thing is that every body's metabolism is very different. So the number what you're getting should be defined person to person. And let me explain you by giving you an example. So I have a client. We have done all the possible changes, a sustainable lifestyle for him, and he's got great results in terms of better energy levels, no foggy or cloudy vision. He had it earlier. Now he's able to drive properly because his vision has improved. All possible changes have happened which are visible, but when you go on the readings, your fasting shows somewhere about maybe 120, or your post lunch maybe shows somewhere about 160, where the normal range is 100, below 100 for fasting and below 140 for a post meal sugar. Here it's very important to understand if you are getting consistently same result. For example, for him, the next for the next few weeks, or we monitor it for months as well, his ranges were in that particular level and there were no other complications seen in the body. which means that for him or his body, that's a normal range.
So is it okay? I just want to understand that, is this normal?
Correct.
Like, for there are people that I know who have 200 sugar as normal. There are people whom I know who have 120 sugar fasting as normal. So is this a normal?
Definitely it's normal, but again the controllables have to be seen. It's not कि आपका 200 आ रहा है और आप कुछ भी खा रहे हो.
Right.
Your controllables are there in place, and then you get this sugar where it's not harming your other organs. Then definitely it is normal. And it's very difficult to fall into like 70s or 80s or 90 sugar levels. But very important is to get a sugar level which you are consistently having. So consistency in getting the readings is very important.
So for on this reading bit itself, I have another question here is the new glucometer that has come, that is the one that we have on the wrist, that
it's
we wear
called
on the arm,
SMBG.
That versus the pricking method, which is more, do you think, is it the innovation in the technology now? I mean, is there something else that we should know which is going to come by or which has already come?
So definitely, we should appreciate the innovation the technology is bringing in the lives of people who are diabetic, and it definitely helps them. Very important to understand who needs it. Okay, so what does an SMBG? It's a self-monitoring blood glucose. What does the SMBG do? It monitors your glucose levels throughout the day, and it is majorly and created, or it is majorly, it is majorly for those who are type 1 diabetics, because it's going to give them a better reading because their body is not producing insulin. So it gives a dietitian or a endocrinologist to monitor their sugar levels and taper their insulin according to it.
Right.
Now, when we talk about type 2 diabetics, so it's so stressful for any diabetic to keep pricking or looking at their glucose levels and not enjoying the food they are eating. So trust me, what I am doing is, whoever comes to me, I ask them to do only 2 pricks in the entire week. One to check your fasting and one to check your post meal, and that's enough, because you are mentally not thinking you're diabetic. आप अगर सोचते रहोगे कि I'm diabetic, you will not be able to come out of that thing which you want to come. So it's very important to understand who need it. I am not saying that you stop using it. It's important who need it. But majority of the population, they don't need it. It's just for the, the brand to sell that device, and it's just a marketing gimmick, or it's just an add-on with a package. So you get so many diabetics package and you are sold by that you're even going to get this device, it's going to check. But when you put and you keep thinking, it is so much of a mental trauma for you.
Right. So what are your, we covered so many things. I think one podcast is not enough to have a session with you. We'll definitely come back, and, I want to do a session on gestational diabetes, babies, and, understanding obesity and relationship with diabetes and cholesterol. So what are your key takeaways, and what do you think, what do you want to tell the audience about, lifestyle, or, dealing with diabetes?
So one thing which I want to pinpoint is diabetes reversal is not a 3-month or a 6-month journey. It is a lifestyle change, and it comes with when you follow something which is sustainable, which you can maintain it throughout your life, and you can attain that results consistently. And that's possible only with 2 things. First is you do something which is very simple. जितना सिंपल रखोगे ना, उतना गोल पे पहुंचने के लिए इजी होगा, and you can reach consistency. The second thing is do things which are accessible to you, which are available to you. Don't think of going to a gym which is 5 kilometers away, because you will go 2 days and then third day you're going to stop doing it, right? So do something which is accessible, which is around you, and that's going to be the 2 key factors which is going to help you to consistently maintain. One more thing which I want to pinpoint is, we usually think कि maintenance is after you have reversed, और maintenance is after 3 महीने के बाद HbA1c 6 के below आ गया तभी मैं maintain करूँगी. No, you have to start maintenance from day 1. आपने 2 दिन में जो result लाया उसको maintain करना है, 1 week में जो result लाया उसको भी maintain करना है. So maintenance has no time frame. It has to be started with your intervention as well. What I usually propose is whatever you are following, you need to be able to sustain it from day one and not after 3 months. So maintenance is not a plan, it's a journey. And one maybe end note is, now is the time to take action. And the first step towards reversing diabetes doesn't start in your plate. It starts in your mind with a thought, with a mindset, with a determination that you can conquer diabetes, and with the right guidance to sustain on a medicine free life.
So on that note, we basically understand diabetes is not something which we really need to be scared of, or diabetes is not something that, reversal is obviously case to case, and uh, you can meet Dr. Riya, or you can consult with her. Her details will be there down in this video, and definitely, if possible, I think she can plant, or she can do that magic in your life, and things will change for a lot of people after this video. However, still I think we should end this on a very positive note by saying that diabetes is not something which we should be scared of.
Correct.
It's a way of, I think now it's a way of life, and we all need to probably live with it. And if at all you cannot accept it as a disease, I think you should just accept it as a challenge, and move forward, and move forward till eternity. So thanks for coming to my show. I think we'll have a couple of more episodes definitely very soon, where we would be. It was interesting to talk to you about this topic. Probably I would want to discuss more about a lot of other things, uh, which in my words are magical. So thank you, Riya, for coming on my show. And if you guys like this show, please like, share, and subscribe. And do consult with Dr. Riya uh, if you have gained something from this video, and she can definitely help.
Thank you.
Thanks.